Good morning, good afternoon, good evening, wherever you are around the world. A very warm welcome to our session, the session number PD6 of the 2020 World Health Summit that unfortunately this year, due to the global pandemic that we are all experiencing, is fully virtual. The session that we are having is called a call to action for health data governance. Just in case you probably ended up in the wrong room, we have a chance then to get into another room. My name is Stefan Germann. I'm the CEO of Fondation Botnar, a Swiss-based foundation here in Basel that focuses on enhancing the well-being of young people in a digital world with a specific focus on urban contexts in low and middle income countries. Now, why are we engaged as a foundation in this topic of health data governance? We started with the focus around digital and AI and data for young people when this foundation's management office was set up in 2017. We very quickly realized that one of the most challenging components related to fully harnessing the power of digital and AI and data is the issue around health data governance. So as a result, the last 3 years, we sort of engaged into investing into several efforts. One of them that is quite well known, as there was a session last year at the World Health Summit, is the joint Lancet Financial Times Commission on Digital Health Futures, with a focus on data governance and the sort of 2030 agenda. Another one is a newly created coalition called the Transform Health Coalition that really aims to advocate and influence the needed sort of data governance frameworks, but as well to ensure inclusion of vulnerable people in all digital solutions. And finally, as well, to drive investment cases at country and at international level. We are very pleased here today to be together in this session, and it's fantastic sort of to have that panel, and I will introduce that panel in a short while. We felt as panelists that it's very important that you as the audience, you kind of from the beginning help us to share with us what are your expectations from this 1.5 hour session. So if you could use the question and answer box at the bottom of your screen, it would be very helpful if during my introductory remarks that I will start shortly, that you would put some of your questions, hopes, and expectations from that session from the very beginning, so that before I then give the word to the different panelists, that I can highlight them, what are some of your hopes and expectations from that sessions, and they can be responsive to your interests from the very beginning, and hence it becomes a more interactive session. We kind of are very much aware that this current pandemic poses immense challenges to public health, individuals, and the economic system as a whole. Governments are being challenged on a daily basis in terms of their responses. But we see at the same time that there is an increasing reliance on digital technologies. Some countries have changed within very short timeframes their legislative approach to enable much more digital solutions that some of us have expected might take 5 to 10 years till some of these changes would have been achieved. We clearly see that some of the domains within the pandemic and the digital health solutions, they are immensely important, at the same time, immensely challenging. Notably, I would like to sort of bring up the issue where we as a foundation have been involved with financing some background research for background technology linked to tracking apps. Many countries have sort of started with tracking apps, but there is a fine line in terms of the public health interest and privacy protection. We've seen that countries who rush very quickly might actually sort of violate fundamental human rights principles of their own citizens and populations at the expense of sort of trying to achieve tracking in their countries. We, through our partnership with various sort of research institutions, notably the ETH sort of domain that includes EPFL in Lausanne and ETH, have sort of invested into fully privacy protecting Bluetooth enabled backend technology that now even Apple and Google in their joint work are starting to use. So we can see that there are technological solutions as well to really ensure privacy. Why is the issue of data governance so critical within the global health space? We've seen over the last sort of 15 years with a digital sort of explosion in terms of data creation. I recall myself very well in 2005. I was based in Singapore after the terrible Asian tsunami that in Indonesia, in the north of the Aceh province, killed over 170,000 people, including a lot of midwives. I was involved in that response for rehabilitation, and that's when I got involved for the first time in digital health, because we were using mobile technologies to enable newly trained midwives, because there were a shortage of midwives, to enable them with fairly simple technological solutions linked to mobile telephones. Now, since then, the data explosion has been incredible. So we have, on one hand, we have tremendous amount of new data in health. At the same time, AI and algorithms are increasingly becoming powerful. And thirdly, computing power is becoming increasingly more powerful and fast. Now, these sort of three convergence technologies, they're creating unprecedented sort of capabilities in the domain of health, from diagnostics to predicting certain patterns in health, etc. We will hear a little bit more today, specifically from some of these technological advances that I know, like Siemens Healthineers, have been, very strong for many years, specifically with a deep knowledge around imaging technologies and the use of big data science and AI. But that brings us back now to the issue around data governance. About 1.5 years ago, The Economist had a very interesting, very short article. It was called Les Stats c'est moi, playing in terms of the statistics are me, playing on the French Sun King's statement that the state is me. And they made sort of a very compelling case that specifically in health, we actually need to be aware that, health data is us as people. So if we talk about data ownership, specifically in the health domain, isn't it that we end up talking about people's ownership? And are we not all collectively at risk that we are sort of modern day data slaves of some large corporations or systems where the data is being owned and kept? These are sort of probably provocative questions. It's interesting to see how Amnesty International, their team called Amnesty Tech, has really started to embrace the issue of sort of data and human rights. Interestingly, I would like as well to note that The Economist of this week actually is looking at the global crisis in human rights that's actually being reinforced now with the pandemic in many settings, where on the state side, states are using surveillance technologies to basically control their citizens. We're under the guise of pandemic control, but with much deeper long-term potential damaging consequences. So the topic that we are having here in this session is absolutely critical. And I want to sort of stop here and briefly introduce the fantastic panel. that thanks to the tech team from the World Health Summit and as well the team who all prepared have been able to put together. I would like to start with Effie. Effie Vallena is professor in bioethics at the Department of Health Science and Technology at the Swiss Federal Institute of Technology, ETH Zurich. It's really great to have Effie, and it's been a pleasure to work with you on many of these issues for the last 3 years. Then we have Dr. Päivi Silanauki. She's the Ambassador for Health and Wellbeing at the Ministry of Foreign Affairs of Finland. And it's really great, first of all, to actually know that Finland has an ambassador for health and well-being, which is for me quite exciting, since our focus as a foundation is on improving the relational well-being of young people in cities. Then it's a great pleasure to have Dr. Bernd Montag. He's the president and CEO of Siemens Healthineers, a company that for many, many years has been involved in these issues and questions. And if I'm not wrong, I think some of Siemens Healthineers have the largest image data sets in the world in terms of sort of the capabilities for analytics. Then we have Bernardo Mariano. He is the Chief Information Officer and Director of the Digital Health and Innovation Department of the World Health Organization. And it's great as well to have you, Bernardo, here. And continuously, as a foundation, we are working very closely with Bernardo and his team and helping together setting up that critical new team within the WHO. And they're making big progress. I was quite recently excited to hear about the ideas of the vaccination cards, the yellow vaccination cards, and possibly looking at digitalization on that on a global level, which in terms of the COVAX for vaccinations preparations would be a tremendous important step to move into that direction. Then I'm very pleased as well to have Larry Gostinier. He's a professor and the director of the O'Neill Institute for National and Global Health Law and at Georgetown University. And Larry really has been one of the global leading thinkers for a long time around critical issues in the space of health governance at the global level. And I know he's been extremely busy the last number of months with the corona-related issues in the US and as well globally that links directly to the topic that we are dealing here today. So I'm sort of quickly now looking at the questions and the expectations that I can sort of brief them to my colleagues here. So one is Jena Broadley, and she's research and teaching assistant at the College of Europe. And she would like to hear the panel's opinion on what could be the role of the EU in the global health data governance space. What concrete actions the EU and its member states can take on at the global level. So some of you who have probably more European sort of experience and context might want to take this one. Then someone is asking the link to the economic article. Well, I will then maybe wrap that up at the end or get directly back to you, but it's the last economic article. And another one is, it would be lovely to hear about health data governance in low and middle income countries in the context of weak digital infrastructures, in terms of technological leapfrogging and sort of some of the challenges that this leapfrogging can bring in terms of regulatory frameworks. And whether there is a way to bring different government stakeholders across ministries together to align these incentive infrastructures. I think that's an excellent question that definitely Bernardo, in his role at WHO, will be able to address with a specific focus on low and middle income countries. Then Elsie Racine, she sort of feels that the pandemic is accelerating the trend towards digitalization, potentially at the expenses of fundamental rights. How can and should health data governance respond to ensure that these rights are upheld? Do you see a set of global standards emerging in this space? So these are the 5 questions that we had up front. So if you as panelists can kind of, when you bring in your input, probably can speak to what some of these questions. And I like to encourage the audience to continuously, as we go along, type in your questions, type in your suggestions, so that when we have the first round of the panel gone and move into the Q&A session, we really can come back to many of the questions that you have put together. So maybe to everyone here on the panel, but as well in the audience, who of you have actually installed a Corona tracking app? And if you have, what convinced you to do so? So, and I'm starting with Päivi. I know that Finland, the Finns had actually been extremely eager to download the app, and from our understanding, there's almost a third of the population actually have installed them on their phone, which is a very high rate compared to most other countries, where currently France is at less than 6%. And we know that Finland has been quite at the forefront of digitalization in healthcare. Every citizen has an electronic health record, and half of the population regularly access their health data online, which is quite remarkable. Coming here from Switzerland, I must say it feels a little bit, we are really ages behind. And last year there was a newspaper frontline coverage which kind of made the statement that Rwanda is more advanced in digital health than Switzerland, which was quite of a wake-up call to some here in Switzerland. So what do you think is sort of helping you at this current crisis, given that you have such a high digital sort of investment in Finland? Over to you.
Thank you for the question, and I'm happy to tell that Finland really has had an advantage of the long-term building of the infrastructure, of the digital infrastructure, but also the capability and that people really can use the digital services. So we have been offering for years for our citizens digital public services, not only health services, but other services also. And it has been extremely useful during this pandemic that there has been digital services and solutions available. So that's why we have for now on succeeded quite well also economically, because it was very easy for employees and employers to then work from home, because they were used to operate digitally. Of course, we also had data registers. We have stored data quite broadly since 1960s, where we all got then also out of our social security number, identification number, and the data is linked to that. But it has also we have been learning how then to keep those registers, quality registers, but also keep the trust from our people here that they can feel that the data is safe there in the registers. And then by offering them services which will help them in their everyday life, has then been building the trust to institutions, but also to government. And I would like to highlight this trust element here. And when you mentioned that our COVID application, it kind of take a longer time for us then to prepare that application, because we wanted to make sure that people can trust that their information and that they can use that anonymously, the application. So we prepared legislation for that, and then had also a public discussion on it. So there was a broad public discussion about it. And then when we launched the digital app, then in the beginning of September, it went very well. And as you said, 1/3 of our population has downloaded it and is using it also, and we have also information, so that it's very easy for people then to have digital information about their symptoms. We have a national application or program where you can go mobile from your mobile phone and then check their symptoms or tell your symptoms, and then it's then leads you to the right professionals and where to go. So we have whole process here working. But I think that this is really up to date discussion today, because if you haven't heard yet, there have been serious data breach where sensitive patient data of private psychotherapy center has been hacked, and the data has been used to extort both the company and individual patients. This is a social enterprise, and it's not the legislation and regulation only that builds trust and makes the data privacy work. One big reason for this breach is, and hacker is that this enterprise company haven't updated their digital systems. So it's so important that we people, while we are working, we keep in our minds what are the secure ways of handle the data, but also that we have all the latest updates run through in our digital systems.
Thank you very much. I just have a follow-up question on the important issue that you bring up related to trust. And would you sort of be able to say how have the sort of like citizens groups or stakeholders be involved in Finland, specifically, for example, with the design of that app? Was there some sort of participatory process, like human-centered design? What did Finland really do to get that sort of level of trust? Or is it just that in Finland, the trust into government for digital solutions is just high because of its past, and you could build on that existing trust? Or were you doing specific issues linked to that corona tracking app that enhanced the trust from the citizens from the beginning?
Yes. Actually, I would say that of course our history is a really strong basis for the trust, and then we have, while we are preparing our legislation, we have always their time for the public hearing and a discussion on it, and there were when we first put it the first version of then the legislation to public discussion. So we got a lot of suggestions then how to improve it, and we did those improvements, and are still learning during the use of this digital application. So it is like the circle of continuous improvement is going on. So when we see that there are some things that needs to be improved, this technical team in our National Institution for Health and Welfare, and also from our Social Security institution, they work for trying to get those improvements done.
Fascinating, and really well done for Finland of having built on that long-term investment, and then really how you harness that now, and how it actually even your economic impact because of that high level of digitalization is actually reduced because of as a mitigation effort. So Bernardo, as the Chief Information Officer and the head of setting up the digital health department, when you hear stories like these of Finland's successful digitalizations, I mean, it makes you probably feel a little bit envious, isn't it? I mean, WHO has been a bit criticized, not just now, but in the past, to being a bit slow in catching up with the digitalization. So what is WHO doing now to sort of really sort of take on its role as a global normative and sort of standard setting organization within that space? And what do you see as some of the most pressing needs that you have when it comes to sort of a global perspective to health digitalization?
Thank you, Stefan. Good to be here. Indeed, WHO, like many other entities, are going through that digital transformation. I think healthcare sector as a whole is going through a digital transformation right now as we speak, and COVID is accelerating that. But as Päivi said, trust is key, and not only that, but the health positive outcomes, the impact of that the digital technology and solutions have to be in line with those health gains or health impacts that we want to see. And as a normative organization, we use, of course, WHO to try to share some of the best practices and norms around. So for instance, on contact tracing, which we issued ethical guidance, for instance, on the use of this proximity tracing applications. But also we did issue a guidance on digital tools for contact tracing. But the key element there is that it is important that digital contact tracing or proximity tracing is an integral part of public health response. And that's where we saw a lot of success when that happened, in addition to other elements such as trust and ensuring that there is ethical use. At WHO, we are working to basically transform WHO into a digital organization. And that's part of the Dr. Tedros transformation agenda, which started 2 years ago, and culminated with the establishment of the Department of Digital Health and Innovation, which I lead, but also the establishment of the Division of Data Analytics and Delivery, just to show that Dr. Tedros and the whole leadership at WHO places digital and data at the center of its work. And actually, as Dr. Tedros said, it's the future of how we respond to health. And in that process, digitalization of WHO is key. I always tell my colleagues that Alexa or Siri can query a WHO guideline and get an answer and deliver that answer to any person that is interacting with Siri or Alexa. That's where we can say that we have achieved that a good part of digitalization of WHO. But also, let's not forget, 47% of the world is not connected to broadband. So we have as we serve digitally the world and has transformed the digital, as we embrace digital transformation of healthcare, we cannot forget that almost half of the world still need to be connected to broadband. Now, in that digitalization of WHO, content, products, and services, you just mentioned one of them, which is the international yellow vaccination card. And it is still a paper-based card. So we signed an agreement, Dr. Tedros signed an agreement with Prime Minister of Estonia, and we're working with a number of other member states to digitalize a vaccination card. And let's remember that as we talk about digitalization of healthcare, we do not have, there are some areas we need to improve, such as, for instance, the immunization record for adults. And many adults use the yellow vaccine card to record their immunization as they travel around. So in that process, in this initiative of digitalization of a yellow vaccination card is also is a use case to look at the broader immunization, digitalization of immunization in the whole population. So this is we're very open and very much ready to work with all member states and all countries and all stakeholders, including private sector, to fast track that. Now, on the data side, a couple of things that I would like to mention that the WHO is doing, like for Solidarity Trial, which we use digital solutions, going through for open access to health research, where we want to make sure that health research is accessible to all, not just for those who can pay the publications that are issued in platforms that the users have to pay, let alone the WHO Academy. But then to last and not least is our member states guided us to ask us to actually develop a digital health, a global strategy on digital health. Within that global strategy on digital health, there is one element which is related to data, which is very key, which is develop a regulatory framework on international health data. So that's an area that from the policy and governance is missing. So by developing that, we hope that we can really leverage on technology, including the ones that are already mature, such as telehealth and telemedicine. But policy does not allow us to fully utilize the potential of those technology. I stop here so then to not take too much time, but happy to answer any questions. And if you have a follow-up question, please.
Thank you very much, Bernardo. And I'm definitely one of those who will be very pleased to have the yellow vaccination card digitalized. I think I'm in the last 25 years, I kind of moved around at least 20 times, and I'm sure I've lost this card about 3 times. So it will be good to have that digital. Now, Larry, we've sort of known each other for quite some time, linked to the Graduate Institute in Geneva around issues of global health sort of diplomacy and global health governance with Ilona Kickbush and others. Some people argue that the sort of ongoing crisis, the balance between privacy on one hand and public health and the sort of public health surveillance on the other hand, has shifted towards surveillance. Would you agree sort of with that assessment? And how can we balance opportunities of digital technologies in health and the implications these have for human rights? And I would think that looking at where we stand, you with your experience and foresight, you must be quite concerned or really worried. Unmute, you have to unmute yourself quickly.
Yeah, thanks so much. Yes, it's really good to be with you. And it was great to see Bernardo and that WHO is taking up the mantle of digital technology as it relates to public health. I've thought a lot about this, and I tried in one of the answers, I don't know if it came through, to send a link to the JAMA article that I was a co-author on just a little while ago that really looked at exactly this question, balancing privacy and public health. And basically, countries around the world with their digital tracing applications can broadly, this is very broadly, be put into 2 categories. One that's very centralized, very surveillance oriented, and others which are decentralized and very much individualized. So individuals can make their own choices about whether they have the app and how the app is used on their smartphones. The problem is that both of those systems are imperfect because they have trade-offs, frankly. The voluntary system, even for a system as robust as Finland's, probably doesn't have enough uptake according to models to actually make a fundamental difference in COVID and other public health interventions. But yet, if you look at the location apps that are being used, say in China, they clearly have, a deep surveillance focus. So for me, I would want my cake and eat it too. I would want both. And I think it's possible to do that with smart law and smart governance. And so this is how I think about it. I think, first of all, it's clear that these kinds of digital applications can be highly effective. We've seen it effective in Taiwan, South Korea, and it's effective in China as well. It's not effective by itself. It's effective when combined with traditional contact tracing, with a testing strategy, with masking, with distancing. So you still need, as Dr. Tedros and others have said at WHO, everything's got to be together. But it can be a very important part of it. But I don't want it to be used for state surveillance and to violate human rights. I don't want it to be used for repression, for censorship of the media or whistleblowers. And I don't want it to be used by employers for discrimination or other purposes. And so how do we do that? It seems to me that you do it by having a very high coverage rate for the application, but the information only goes to the public health agency, the Ministry of Health or someone else. And by law and rigorously enforced, that agency can only use it for strict public health purposes. And you've got a firewall against state surveillance, police and law enforcement, any censorship or employment or other adverse impact. Because I think the public, the public wants to end this COVID pandemic. They want to get health for the population. But they don't want government to be using their data for non-public health purposes. So you need to box it in. You need to really rigorously regulate how these apps are used, who can have access to them, and what the purposes are. And that way you can help achieve the public health purpose, but not spill over to other law enforcement or surveillance purposes, which are inappropriate from a human rights and democratic values perspective.
Thank you very much. And I think that this sort of boxing it and really protecting in terms of citizens rights to privacy, with that balancing in terms of the public health, sort of the collective, is really that critical approach. And technology can actually contribute increasingly to this as well. There are sort of, I know, the different sort of methods specifically around AI. One is called split learning and federated learning, where actually even the need to bring data together is no more that big, that hopefully in the future most of the data can be kept on our own devices, doesn't even need to be centralized, and still you can make sense of some of the data vectors to really analyze them for whatever you need to have at the aggregated level. Which brings me to FE. I mean, ETH Zurich is one of the leading drivers of new technologies in the digital space and AI, with sort of I think now more than 100 professors dealing with AI related issues. The ETH Zurich just launched actually last week the AI Center, with a major sort of creating platform on this. I recall that in an interview a while ago, you said that COVID is the first sort of real big pandemic at the global level that hits us in the digital area, and so we kind of naturally think that all our responses has to be digital as well, and lean on that quite heavily. And therefore, we have digital epidemiology. We have sort of, as we mentioned in the conversation before, the contact tracing apps and other things. But you kind of reminded in that interview all of us that this is sort of a big social experiment with many unknowns. Can you expand a little bit on this?
Thank you, Stefan. And first of all, thanks for inviting me to this panel with wonderful colleagues from around the world. And as a disclaimer, I just want to say that I have downloaded my Swiss COVID app, the proximity tracking app, and I've been using it, partly also because I was involved with the group that the Swiss Science Task Force that was involved with that procedure. I do believe that this is a big social experiment because, at least also in the digital sense, because we never before were so advanced technologically and digitally like we are today. Yes, there are differences between countries in terms of their level of digitalization, where we are in transformation, but we around the world we are at a level today that we've never been before. So inevitably we turn to our digital tools to find help, and I think that's a good thing. There's enormous potential, but one first, I believe, also hurdle we had was when we thought, okay, we had contact tracing. Contact tracing is a traditional method in public health. Let's now turn to the digital technology to help us with proximity tracing and contact tracing. One of the first things that we had to somehow establish is that thing works. And that's a very difficult thing to establish, partly due to the point that Bernardo mentioned, which is the app on and of itself, it's not going to work unless it's embedded in a system where you get your code, you get your testing, there is follow-up, there is guidance for quarantine, etc. So having an app wouldn't work. How do you do that? It's challenging. At the same time as well, we wanted quite wider coverage, and Larry mentioned that we need more people to be using these technologies in order for these technologies to be doing something. So many variables at the same time in a brand new thing that we're exposed to, I think have made it quite difficult for this to say that yes, it works, we've launched it successfully, and people trust it. So I do think that what has been happening is almost understandable. We've seen Finland is perhaps an exception. In many other countries, we've seen a low uptake. But if you take the example of Switzerland, where we do have a society that's trusting the state, it's not, we should trust deficits everywhere in the world. In Switzerland, I would say we do have a certain level of trust to the states. When polls were done in the spring about whether people would use a tracking app and who would like to authorize or to own or to issue such an app, the majority of people said are willing to use the app and would prefer it if it's state issued and controlled. So that would be a proxy for some sort of trust to the system. Once the app is launched, a few months later, we went through a legislative process, as Larry mentioned. In this case, in Switzerland, we had parliamentary sessions. We created a law specifically addressing details about how the app works, who can access data, every single detail you can imagine, a form of legitimization process. We come to August, September, the uptake of the app is very low. And still already now we're facing the second wave here in Switzerland. We're still struggling with an app. We're getting better, but we're still low. So I think part of this experiment is to figure out what is really, we have a theory about what we need to do. Effectiveness, for example, proper legislation. We need to do proper communication, but I don't think we yet have figured out what all the elements that are needed here in order for these technologies to be properly embedded and adapted and actually do the work that they need to be done. And one of the things that my colleagues and I have been working on is this idea of adaptive governance for these technology tools, which means also that we have a way in which we adapt to the development of the situation, to the needs of the people, and to their responses. And so, at least in an argument we've been trying to advance is that if we are getting better at this form of adaptive governance, we might have a better chance to do things more efficiently, especially in the context of crisis, where we have to move quickly, things change at the pace that we're not used to, and we have to respond. So that's sort of, I think in the social experiment kind of approach, my view about the social experiment, thinking more in the same way that Larry mentioned smart law and smart governance, I think adaptive governance could be a way to help us move this forward in a better way. We haven't fared extremely well in this first phase, I would say, globally, but we've got a lot of interesting things that we've learned.
Thank you. And in the second round, I really would like to get back to you and as well, Larry, around this issue of more dynamic regulatory and legal approaches, because the rate of innovation, and Bernd will sort of probably share with it, the rate of innovation within the tech field is so rapidly that regulation and legal sort of frameworks behind are really not catching up. and there is new ways of thinking, and how can we use digital as well in the governance, actually, rather than trying to use traditional governance approaches to regulate and govern sort of digital. And there are some sort of initial ideas of like toolbox approaches for governance of health that's sort of becoming more modular and more agile. And there's some groups I know at the University of St. Gallen who are starting to think around as well new ways of using digital for digital health governance. But now over to you, Bernd. Siemens Healthineers is really at the forefront for many years on the digitalization of healthcare. A large part of your business is really dealing with data collection, data analysis, you know, from patient management systems, your whole diagnostic imagings, etc. And you know, you're definitely very convinced that there are huge opportunities from digital health solutions in the crisis that we face now, but clearly beyond. Are you sometimes a little bit frustrated that we continuously having these discussions around data protection and privacy and sort of data governance? And what do you, from a sort of you know, large global business in that space, see would be a way forward?
Yeah, it's a good question. I mean, I wouldn't say frustrated. I think certainly, I think we could be faster as on the planet, yeah, in the uptake. And when I look at the slogan behind you, yeah, I mean, it is very much also about what your foundation is about. Yeah, it's about accelerating things. But what we are also very convinced of here in Siemens Healthineers, and I personally, is that if we do not address the concerns and the fear, yeah, we will not do ourselves a favor. Yeah, and in the end, every technological advancement is about making healthcare more human. Yeah. And the concerns need to be taken super serious. Yeah? But I think what I would like to bring a little bit into the discussion is there's a topic, we are in charge of what we do, but we are also responsible for what we not do. Yeah? And in the end, every progress, yeah, in what digital health can bring to mankind, which we do not make, is also harming people. Yeah, and the thought I want to bring in is that the goal we have is to make medicine better, and data protection and privacy is a boundary condition. Yeah, on that target. Yeah, and there's also the risk, yeah, that we are not doing something which could help. Yeah. And sometimes I think this aspect is coming a little bit too short. And ironically, yeah, you know, I used the time when I listened to the others a little bit to look up the Hippocratic Oath. Yeah. And it's very clear already back then. Yeah. It's clear the main target is to make medicine better, yeah, to do the right thing for the patient, yeah. And then he already has this boundary condition. And whatsoever I shall see or hear in the course of my profession, as well as outside my profession in intercourse with men, if it be what should not be published abroad, I will never divulge, holding such things to be holy secrets. Yeah, so it's not a new topic. Yeah, but we would always say the goal of a physician is to do the best for the patient, and the boundary condition is to protect the privacy. Yeah, and we have to balance the two, or let's say, or we have to make sure that the one thing stays the boundary condition, and the other thing remains the main target.
Thank you very much. I will get back to you on some specific questions linked to then, you know, what from an innovation point of view, some of this. But I would like to get back to Larry. I'm aware, Larry, that you have another engagement that you were unable to shift, and you have to leave us in about 10 minutes. So I would really want to take that sort of time with a specific issue and a question that actually one of the Florence Gowdery Perkins, hi Florence, was good to catch up with you last week. And she's writing that some of the biggest challenges underlying both AI and data and digital health are sort of common standards in terms of interoperability, regulations related to privacy and security, etc. There are some others who have been sort of starting to think, is there need for some sort of a framework convention or an international health data regulation, but obviously something that's more agile developed and doesn't take 10 years of global negotiation till it's in place. So it'd be good to hear from you. Some of us think that with the WHO and the digital health strategy that the World Health Assembly has sort of signed, that probably the World Health Assembly would need to look at some sort of an international framework or an agreement that really deals with these things from a global perspective. But starting with those low-hanging fruits, but what is sort of your take on this, if you could use a few minutes to expand on that?
Sure. Thanks, Stefan. It's a really great question. And my apologies to all of the audience that I do have to leave at the top of the hour. I regret that. There's been a lot of discussion about trying to find international agreements, not just in this area, but other areas, because it really is a collective action problem. When you're talking about a pandemic, you really want to have rules in place so that it's more that the principles and values are more consistent across jurisdictions, so that all of our human rights can be protected, all of our privacy can be protected, but all of our public health can be protected as well. And so I think there would be very clear principles in such an international agreement along the lines that I mentioned earlier, and I could specify them even more. The problem is that there is a significant distaste in the international community for global agreements. Sovereignty, populism rears its ugly head. And so, you mentioned a framework convention. That's one idea. The international health regulations might be lower hanging fruit, and I'll come back to that. Or we could use some kind of an innovative type of agreement, which is more soft law, but does have binding aspects, like the WHO's pandemic influenza preparedness framework, which was really not perfect, but quite effective and very innovative. It uses international contract law rather than as an international treaty. But it seems to me that that any of the approaches that require a framework convention or a new set of regulations, which are the two constitutional powers that WHO has, or even a PIP framework, which took 5 to 7 years type of agreement, are long hauls. But the lowest hanging fruit, I think, is the reform of the international health regulations. It is because it's currently very much under consideration. The World Health Assembly asked WHO to form an inquiry into the COVID pandemic, both backward-looking and forward-looking. And clearly front and center, I know this from talking to Helen Clark, one of the co-chairs and others of that group, that the international health regulation reform is really important. We're looking at things like independent verification of country reports and things. So that's where I think looking at some principles for digital applications could be best utilized. Now, I've got ideas about how you can do that without opening up the entire IHR for renegotiation, because that would be a nightmare in the current political environment. But we could think of using annexes, like an annex, a separate annex on digital applications. And I think we could go a long way toward making some progress here. But I would use the current governance system we've got, which is the international health regulations, but improve it and build upon it as a concrete step that I might take.
Well, thank you very much. That's, I think, a very interesting sort of perspective and angle that's definitely worthwhile for WHO and member states to consider this idea of sort of an annex as part of that sort of review of the international health regulation, which was 2005, right, where digital was in the last 15 years. It's amazing what has happened, and so yeah.
And if you think about one of the questions we had early on, say what could the European Union do? I mean, the European Union could have regional, it already has a data privacy rule. It could use regional guidance about how to balance public health and privacy, but it would only apply to the EU. The EU has more or less common democratic values, whereas we want this to apply more globally. And so WHO might be a better organ than the European Union, but the European Union could drive it at the WHO, because I know the EU is one of the world's leaders in thinking about privacy and public health.
Yeah, and actually interesting. So in a meeting last year with the German Minister of Health, Jens Spahn, who has been driving incredibly the digital sort of space in Germany and achieved with their new digital sort of health law considerable uptake. He has been sort of mentioning this sort of role of WHO and with WHO Europe and European Union to sort of really look at how to move this agenda forward. And so I think with Germany, France, Finland, and many others, I think they could probably pick up that idea of an annex linked to that sort of revision around the international health regulation, which would already sort of be helping a lot to move the agenda, because currently it's so fragmented. It's really damaging our collective interests. And so it's really high time that something concrete is actually moving forward. So for you, Larry, I thank you a lot for having made time. I know it's still a bit early for you where you are in the US, and would like to go to you, Päivi, to sort of link on that, but specifically refer to a report that Philip Alston, he's the UN Special Rapporteur on Extreme Poverty and Human Rights. He wrote a report last year called The Digital Welfare State that he addressed to the UN General Assembly. He is quite an outspoken critique in this report, and he acknowledges, because there's a lot of positive being said about digitalization, that he doesn't need to repeat all the positives. So he had quite a look, and he sort of warned in its executive summary to the UN General Assembly a term that I don't think I have seen in any other UN document, that he says that we are all at risk of sort of zombie-like stumbling into a digital dystopia. And he writes, and I quote him from this report, "Digital technologies in general, and especially those central to the digital welfare state, are often presented as being both unavoidable and irresistible. However, the reality is that such decisions to pursue digitalization are all too often taken in the absence of sophisticated cost-benefit analysis. Values such as dignity, choice, self-respect, autonomy, self-determination, and privacy are all traded off without being factored into the overall equation of cost-benefit analysis." If you look at Finland, you have done a lot, as we mentioned in the opening sort of session, has done a lot in the digital space. What did you do in terms of cost analysis, cost-benefit analysis in Finland, and how are you ensuring that these other aspects that are probably hard to measure in a cost-benefit analysis of dignity, choice, self-respect, autonomy are really taken care of? In his report, he, as Mel mentions, really the risk that traditionally citizens were keeping the state accountable. But with the sort of digital welfare state, with suddenly the carrot and stick methodologies, of welfare benefits and even in health, that the state is starting to take, keep citizens accountable rather than the other way around. So it would be interesting to hear from you and Finland experience.
Yeah, thank you. What an really inspiring and interesting discussion we have had here. And I would also like to comment some of my colleagues' ideas here. But answering to your question, I think that right incentives is really a core issue, as the trust is also. But Finland being a welfare, taxation-based welfare state, where we have universal health coverage, and in our constitution, actually, we have a right for those social and health services that each of us needs. So it is in our constitution. So it gives a really strong incentive for our state then to ensure that, and it is and one thing I have to take here, still what is in the constitution is that equal right. So not depending on where you live or what is your economic situation. So it is an equal right. And so it gives an incentive for our public sector then to try to find out the most effective ways of giving those services equally. So and then when as I told you that we have a long history that people are really, I would say, even excited to have kind of wearables and digital devices and using their digital tools and information. In our schools, we educate people so that they are already at the lower grades, they get used to use the digital devices and digital information and data there. And in our high schools, they work with their iPads and digital tools also there. So it is embedded in our processes and educational processes, but also in our public services, so that we have the digital services. We have only 5.5 million people living in Finland, and it's quite a big country, and there are remote areas. So we really have to think that we don't have enough professionals. So we have then to try to find out the ways how to offer the services. And here the digital services have been, and telemedicine has been an answer to that. So here comes the incentive from public sector, and when it is and then also the inclusion, digital inclusion, so that people has to have access to these digital services and tools. And of course, if there are people like some of the older people or then other reasons people are not able to use those, so they can get the services in the other way also, so that there is then commitment to give those services. So inclusiveness, but also a capability, and then right incentives to do that. So and then have an open democracy system and rule of law respect to everything we do. But as I mentioned in the beginning, so we still have to point out the importance of handling the data. Not only regulation, but handling the data. And then because it's not only the patient records, it's 100 other electronic systems that, for example, healthcare organizations have there. So there have to be updating, continuous updating, so that you have the data security inbuilt into your systems. And that has been highlighted now during the last few days. Coming to Larry's suggestion, we are really happy to work with WHO and me and my colleague from Germany sitting in WHO's executive board, we are really also having the discussion with other colleagues there sitting in EB and there is coming now WHA meeting in November. So that how then to proceed from where we have.
Thank you so much. You're on mute. You somehow muted yourself.
Yeah, and I would say also that European Union is working hard and due to COVID. I would say that this has been enhancing the processes, trying to find out the ways inside our region what to do. And as the President von der Leyen then mentioned in the State of Union speech that there will be coming next year digital legislation regulation then in, and Finland is one of the most active parties there, trying to then find out solutions how the European data health space would look like. But not only European health data space, we need also European data space here inside Europe. So that it would be then easier for all those startups and organizations that already have a lot of solutions we could have use as we heard from Siemens Healthineers, there is a lot we could do better already with the devices and solutions we have. So we need to have more common kind of ethical and legislation and regulation and rules. And I see that also that Europe would be, and EU would be very good player here. And not restricting only to health data space. Finland is also leading with France and Germany a process inside EU concerning the sustainable data economy, which then means that we should go towards my data based thinking, where we can then combine and the different data we have there, and that would definitely be done in that way that it is safe and respects the privacy. But there are processes going on, and Finland is active there, and we have really a great window of opportunity now here, working also globally. WHO being part of the implementation of UN Secretary General's high-level panel on digital cooperation, and also the plan how then to proceed. And Finland is there also leading happy to lead the artificial intelligence part of
Thank
that.
You. Yeah, I would like to as well hear from Bernardo, both from WHO, but put yourself in maybe Mozambique's shoes. The suggestion that Larry has put forward in terms of maybe an annex linked to the international health regulation, and then I would like to hear as well from Bernd from a private sector perspective, where on one hand, sort of a better global enabling environment would actually help a global company like you to have better interoperability, better sort of regulatory sort of frameworks that are better aligned, but sometimes regulation can as well undermine innovation. So how do you sort of see it from a private sector perspective? And then as well, Effie, from your sort of data ethics, these sort of suggestions to have maybe an annex, is that strong enough, an annex within an international health regulation? Let's just stay a little bit in that, but start Bernardo and then Bernd and then Effie.
Thank you. Indeed, let me start by saying that WHO is owned by member states, so the member states will certainly already alluded to the need to relook at a couple of things. The DG already set up this independent panel for pandemic and preparedness response and review panel to look at that. So based on that, I think based on the experience of the pandemic, both the member state and WHO, I think we are learning a lot. And then out of these learnings, we certainly see areas to change, to improve, including the IHR. So certainly this is something that as Peggy said, during the EB discussions or WHA discussions within the member states, from the WHO perspective of the Secretariat, we see a big need to move fast on that, not to take 5 years, but to take much less, because 5 years in digital age, it's almost more than half of the age of that particular digital solution, if not almost time to retire, right? So I think there is the need to move fast. There's the need to move with and create this trusted ecosystem. Now, coming from Mozambique, and I always sort of try to make sure that we don't forget the least developed and middle-income countries in the whole digitalization or in the whole transformation of the digital transformation of healthcare sector. And the role of WHO is to ensure that we apply the right tools and the right investments for the right level of maturity on digital of that specific country. As a result, we are, and as part of the global strategy on digital health, we have one of the outputs is the dynamic digital health maturity model, to ensure that the investments are done in such a way that are sustainable, but also that addresses the country needs, but also brings the benefit to ensure that if the country needs underlying infrastructure, we don't go and invest on something way advanced, which then will render it not sustainable. So that's very key, and we also launched recently the Digital Implementation Investment Guide to really show how we want to help countries on how the level of investment, the maturity of the country, they go hand in hand to ensure that we reap those benefits, let alone the privacy and ethical. And of course, the European Union is quite an advanced GDPR on data protection principles, where we set we use it as a resource. And I think in ensuring that digital solutions work well in Europe without overstepping on those principles and underpinning the GDPR is a good set of examples that we can take to the rest of the world. Understanding that each part of the world have the different principles and privacy rules that some are very much trust-based in terms of a central government, others are less, and how can we strike that right balance? I saw a question in the chat as well about the fact that the WHO has digital health and data separated. Both of them are very cross-cutting. The digital without data, it is not digital. So the question is how we can ensure that the very cross-cutting area of data the governance of that is such that all the digital solutions, be it AI, be it other technologies, they really leverage on those. And let's not forget also the local context. So as a result, for instance, we have working with ITU on benchmarking of AI solutions. So that's one area. So partnership is key. And that's one of the key first element in the global strategy of digital health, because we can bring as much as we know from WHO, but we also need to bring the private sector with as much as they know. We need to bring the government with as much as they know, the civil society. So to really leverage on the best of each one of us in different sectors to really deliver that outcome we want. And WHO has the convening power, so use WHO to bring those entities together. So we are there for that, and we are there to add value. And as I say, in terms of reform, in terms of changes on IHR, member states are already alluding to that, and we are ready to move into that. And I think some movements around some adjustments based on the lessons from the pandemic are going to come forward. Thank you.
Fantastic. And I think it would be probably good, and maybe as a follow-up from the World Health Summit, together with some member states, to start drafting an annex to the AHR that sort of brings in some of the digital, but now from a private sector perspective, where Bernd, if you can give us some of your views.
Yeah, I think that I mean we are currently, I think, losing too much time in individual discussions about what are exactly the boundary conditions and so on and so on. And it seems like we are rediscovering the challenges, 100 times per month. Yeah, and that is not really innovation. Yeah. So I think what would help us is, on the one hand, I was quoting the Hippocratic Oath, which is 2,400 years old, and it's pretty simple. Another more modern way of something simple is the Sustainable Development Targets of the United Nations. Yeah, I mean, it's very simple. Yeah, it's not some 300 pages document and whatever. Yeah, so. And I believe that getting something like this done, so that there is common agreement and something like some kind of a codex one can refer to, would help wherever it comes from. And some thoughts I would have for it is, I mean, on the one hand, what I said before, it's about the responsibility, what we not do. Yeah, there is so and so much help which could be, especially also in countries, in emerging countries, where there are not enough healthcare specialists, where often even if there would be money for medical equipment, then the specialist is missing. So this can be helped with AI and so on and so on. So I think we need to make clear, so I have some biases, the patient owns the data. The patient has a responsibility, because his data and the success of his treatment is very often, especially like in countries like in Finland, but in Germany it's very much the same, is the result of a socially, of a commonly financed system. Yeah, so there's also a responsibility to give back, in my opinion. Yeah. And not doing this is also a responsibility, or not living up to a responsibility. And then the role of industry is not to claim IP for something which has been generated by others. The role of industry, of us, is to automate, to make it user-friendly, to spread it, and so on and so on. And I think I'm giving these examples because once this is clearly fetched out, clearly formulated, and one could say, hey, we follow the so-and-so principles, it would help a lot. And it would help that we don't have the same discussions over and over again. And again, it is really about it's about helping people to live healthier and longer lives. This discussion, it's not a luxury discussion.
Yeah, I think Effie, that links nicely to you. I mean, you've given a lot of thought on exactly that issue that Bernd is bringing up. Sort of, okay, we want that the data is owned by the individual citizen, but there's that public interest, and a lot of if I do a blood test here in Switzerland, is that result now just mine because the doctor was trained by taxpayers' money and all of that? So there's an interesting blend. And then maybe Effie as well, I know there's for example, a Berlin startup that works on voice diagnostics, seems to be becoming successful. So if Siemens buys that up and sees, well, that's great, that has multiple use, not just in health. Maybe HR departments can use that because you can screen for depression and anxiety, and then HR department just need to use that in the telephone conversation when they interview an applicant. How do we protect that these technologies that are emerging are not suddenly, moving into other spaces and discriminate outside of the health space and things like this?
Right. So let me
He just not indicating that Siemens would ever do something like that. Siemens has a very strong track record on
but I'll like to start with Bernd's last point, that we don't want to reinvent the wheel and have the same conversations again and again. And one thing I'd like to point out is when it comes to data sharing and data access, we have the same conversations for a long time, and we have them in many different fora and with many different panelists and in different contexts. And still we're making slow progress. And that's something that at least has bothered me. I did some work in looking at do we have enough guidance? Do we have enough evidence about, do we have an agreement in principles around data access and sharing in the space? And I'm staying for the time being in the space of health. I'll come to your voice recognition in a minute. And it seems to me that we've done a lot of the conceptual and theoretical work about why it is important to have access to data, why it is important to make progress and distribute it equitably and fairly so everybody benefits from that. Why do we have to build trust? We have a lot of conceptual thinking, and yet it seems to me that operationalizing those principles and making them work in action, when, for example, I have my blood test in a hospital here and you need to access it from somewhere else in the world because of your study, there we'll have a problem. So I think what seems to me that where we need to put our efforts is to see how can we translate a lot of the theoretical work that's been already done, and we don't have necessarily to redo it because we have it. How can we translate those principles, those ethical responsibilities that we've theorized about into action and get the things to work and have the access we're working about and we're thinking about. So I do think one of the ways is to go towards the regulatory approach and say, okay, let's set the boundaries, let's set the rules so we can have access. Let's call things that or the other. And there we've seen some movement, for example, in the European with the GDPR, we're trying to acquire some clarity. There's debate about how much the GDPR facilitates access to data or not for research purposes, for example. So again, even in forward-looking regulatory moves, we see that the specific issue of data sharing and access, it is still quite a struggle. So I do think the effort has to be given into trying to translate that, whether that's with specific regulatory action or with governance, where a lot of signatories will sign up to and say, okay, we agree that these are the principles, and here we agree that this is the way we're going to operationalize them. I'll give you an example. The OECD has done incredible work on data governance, health data governance specifically. We have a document out signed by a number of ministers since 2017. When we look at how has this been implemented, we're seeing that we're struggling. And so again, that's a very concrete example of how we need, for example, take that health data governance principles and see how we're going to make it into action. So there is where we need the political will. I think there is where we need the cooperation and collaboration between the private sector and the states. The private sector is going to playing a very important role. And there where we see the conveners like WHO being the force where we'll bring them to the table and say we agree on those things. So I think we are at a very good point in terms of conceptual work that's been done, in terms of growth. We've lived with the digital for some time. I think the pandemic is a catalyst because we saw very up close and personal what it means to have or not have access to data. It's a matter of life and death. We see that things can happen fast if we want them, and very slowly if we find excuses for not doing them. So the timing, I think, is great, and we should move towards that. Whether it is the IHR annex or not, again, that's a different kind of conversation. IHR can take care of some things, and I think it'll be great. But beyond IHR, we do need access to data for more than international emergencies. We need it for development of AI. We need it for all sorts of things that I think they're important. So I think for the bigger picture discussion, these are my thoughts. In terms of how we avoid the situation where the technology...
May I just...
Yeah.
We're running out of time because we have to wrap up in 5 minutes, and I would like to give each one, including yourself, a final sort of statement. And I would like to start with Bernardo. And the question would be, the session is a call to action for health data governance. For each one of you as a final thought, 2 sort of points. What is for you the kind of call to action that you think should happen collectively? And what are you doing individually within the next 12 months that in 2021 at the World Health Summit, you would say, I've done this to improve health data governance? So one is a call to action from your perspective, and one is an individual task that you assign yourself that you want to have your own contribution in that space in the next 12 months. Over to you, Bernardo. And then
I'll be very quick. The call to action is really to work together to develop this regulatory framework on international health data. This is key, and it's already enshrined in the global strategy on digital health. So we want to work with all partners, the government, member states, private sector, civil society, and others to really come up with a regulatory framework. Can be a soft, slightly binding, or very binding, depending on what we collectively want to do together. And what we're doing is to get that global strategy details through the member states to get approved, so then we can start implementing it. Thank you.
And what is your personal commitment in the next 12 months to make that happen? My
personal commitment is to give my everything that I can give to ensure that we really move, we apply digital solutions in a digital ecosystem, and in a way that we bring the value, we bring this health outcomes. Personally, it's my full-time commitment, but also dedication, and as well as bringing the team together, but on WHO side, both on the digital health and innovation, as well as working together with the data division and all stakeholders, both internal and external, to bring it together. So we are building, so that's my commitment, to really create the framework to make that happen.
Thank you. Bernd?
Yeah, I mean, call to action, I think I repeat myself, it is really about looking at the opportunity, yeah, and looking about the danger we have if we don't do something, yeah. So, and doing it in this spirit, how much positive we can do, yeah. I mean, the personal commitment, I mean, as you may know, I mean, we are currently in a very important phase of our company, yeah, because we are combining with Varian, yeah, the leader in cancer care worldwide, from a technology point of view. Cancer is a much bigger pandemic than COVID, yeah. I mean, but we got so used to it that we don't realize. And cancer, even more so than COVID, relies on basically knowledge, yeah, data sharing, yeah. What we will do, what I will do is I want to make sure, yeah, that we set up from the beginning on the right framework, yeah, that patients will benefit, yeah, from this combined treatment and diagnostic domains which we bring together, while being a role model in data privacy. Yeah.
Thank you. And Effie?
So mine is, I think, the political, how to translate the principles, translate the theory into action, which means specifically for me, amass the political will to delineate the rules under which and the conditions under which we can do this as a global community. I think that's the call that I would put out there. And what I do in that as an academic, I work on a specific aspect of governance, on adaptive governance, as I mentioned to you, on health data. And I'm working with WHO, OECD, and others, hoping to provide as much of at least the theoretical work and support to these organizations to move the needle.
Thank you. And then last, not at all least, Päivi, from your perspective.
Next step would be European Union then to begin the work towards GDPR 2.0, where we would have a sustainable data economy, where my data, so people are owning their own data, and still we have a respect on rule of law and data privacy. And my personal commitment, I will personally work with Fernando Mariano and also Amandeep Gills, who is responsible on UN Secretary General's high-level panel on digital cooperation, the health roadmap there, to give all the experience we have had from Finland, and trying then to collaborate and cooperate and get the ethical minimal principles for how we can globally have advantage of all those digital solutions we already have and coming in the future. Thank you.
Fantastic. And so my call is as well that we urgently need, specifically highlighted in this session, but as well in the pandemic, we need a global sort of agreement on some of these critical elements that's agile, that's quickly developed with WHO and the World Health Assembly in the lead. And my personal commitment is to really ensure that human rights sort of are highly respected in these sort of whatever tools and guidance we are developing, and continuously working with WHO as the sort of normative global standard setting agency that really can help us to move forward in this space, respecting individual citizens' rights. Fantastic Sunday we had together. Time is up, and so thank you as well for all the sort of 50 participants who spent the Sunday with us and engaging in this topic. Thank you so much, and all the best. Thank you very much to all the panelists. It was a pleasure to be with you.
Thank you. Thank you.